it's day 2 of hospital stay. So today I will start my chemotherapy, but I don't know what time they would begin it. My sister is still asleep. So it's 8:25 a.m. and they've already started my chemo. So the first chemo drug is fludarabine. It's gonna run for 30 minutes. After that, the following drug would be cyclophosphamide, and it would run still in 30 minutes. So yeah, expected side effects are nausea and vomiting. But I hope that I wouldn't vomit because I already vomited last night. Carol's having a meeting.
Work never ends.
So I'm tired. I'm very tired from chemo. And this morning, I had a fitting for the radiation on Friday. And I just found out that I will be butt naked during that total body irradiation. Lucky me. It's hospital day 5 and it's 6:30 a.m. I just woke up from a announcement that a code blue is ongoing on our floor, on our unit. So someone here with cancer is fighting for his or her life. Like, literally.
So how are you feeling? Can't breathe. Are you nervous?
Not really.
Your face is puffy.
Like, feel ko na ako.
Is it because of the mask? Good kayo siya, Day.
Good morning. It's day 0.
Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you.
Hospital day 11 and transplant day 2. Last 2. And I don't feel good. For the past 2 days, I had fever. I had body malaise, fatigued. Since yesterday, my tummy was aching. And yeah, that's an update. Transplant is not a walk in the park. Truly. Bye!
And then ongoing platelet transfusion. Yes. Thank you to the donors. And I'm hooked to oxygen and yeah, and to dopamine drip because I had some sort of congestion, and dopamine drip because my blood pressure has been dropping. But so far, I've been feeling well compared to the past 2 days. The past 2 days was very rough. I had chemotherapy, by the way. So yeah, bye! It's hospital day 15 and transplant day 6. And praise Jesus, I'm feeling better. I'm not hooked to oxygen anymore. So the results of the ultrasound, KUB ultrasound, and to the echo were Basically normal. What else? I don't have my Foley catheter on already. They had to remove it because of the leak. I'm just experiencing some rashes and hemorrhoids. My hemorrhoids are so bad. Oh my gosh, it's day 13 and 22nd is hospital stay. Currently my intestines are inflamed, so I'm on TPN, total parenteral nutrition, directly on my veins instead of the gastrointestinal tract. And because of that, I have increased fluid intake, so I'm again experiencing edema. So I'm on oxygen.
Hi. So it's June 7. It's almost 5:30 p.m. I'm 1 month in the hospital, and right now I'm on oxygen. This morning was really tough. They had to do a stat CT scan and ultrasound of my chest. I had really bad pain on my left lower abdomen, and I had chills and fever. But the CT scan result showed normal abdomen, but they found out that there is fluid in my lungs, or pleural effusion. So they did an ultrasound to see how much fluid was there. There was about more than 400 ml of fluid on my right lung. So tomorrow I'm scheduled for a thoracentesis, where they're gonna drain the fluid, and I think they're gonna culture the fluid and see what infection or bacteria it might have, because they're thinking that it is what is causing my fever, my infection. So yeah, I sound breathless, and yeah, it's been really so tough. Bye. And going home. I am in my wheelchair.
Hi! So it's day 50, and yes, I'm showing off my beautiful bald head. I went into the hospital with hair, insert photo, and got out without it. I was supposed to shave my head prior to admission, but I chickened out. Actually, I was hoping that I will lose my hair after discharge, but oh boy, just 2 weeks after transplant, my hair started falling in clumps. So yeah. So before my life update, I just want to wrap up my stem cell transplant experience. So if I could describe it in one word, it's tough. Tough. As in, the transplant experience is probably my toughest experience yet. Unlike when I had severe pneumonia last year, I was drowsy and mostly in and out of consciousness. But this time, I was very alert. So I felt every pain, every discomfort, every anxiety. I struggle with hope, with faith. Many times I've cried to God like, Lord, I can't do this anymore. I am not able. Still, I felt Him tell me that you can't, but I can. I am able. And now looking back, I wish I could have had a better attitude, a Christ-like attitude during that hospitalization. So for the life update, it's been more than 3 weeks since I was discharged from the hospital, and I've been going to my oncologist weekly for consultation. This will go on until my day 100. So what am I doing for 100 days? Isolate. Yes, isolate. I am going to watch out for side effects such as infection and GVHD. So GVHD stands for graft versus host disease. It can occur in the gut or the stomach and the intestines. So my bowel movement is monitored. It can occur in the liver. So my liver function is monitored, or it can occur in the skin.
So a couple weeks ago, I had GVHD of the skin. Like I had very bad rashes all over my body. And for treatment, I'm taking steroids. So because I'm taking a lot of medication, including anti-rejection drug, my kidney function is also being monitored. I'm actually kind of worried because at present, my creatinine is elevated. But hopefully, hydration would help it. Recovery has been slow. I'm tired. I'm tired most of the day. I just sleep. And taking a shower is an accomplishment. This is an accomplishment, taking a video and editing a video. But I'm able to ambulate more, so I'm grateful. So to close, I'm sharing to you my story because aside from I want to bring glory to God, to Jesus, I also want to give others perspective. So I think that's my word of the year, perspective. I think that our perspective influences our attitude towards circumstances and our empathy towards others. And our perspective is shaped by a lot of things, strongly by our faith. I think also by the stories that we hear, the stories that we see. So I hope that by sharing my cancer story, I would be able to give you positively some perspective, even just a little, especially in these most trying times. So yeah, thank you, and I hope to share some good news on my day 100. Bye!